We are really getting close to the conclusion of this particular module, and what I want to do is give you some examples of improvement and first go over that functional outcome index or the Oswestry index to show you exactly what improvement would look like and how you can score it for yourself. Here we are again. You've seen this before, and this is the functional index that's called the Oswestry index. Recall there are 10 different categories that we discussed earlier, and I'm outlining them right here. And within each category are 6 different blocks or potential choices to select. Now, each of those blocks represents 2% if you've completed the entire form. And as you'll recall, the scores get lower as you move from the lower part of the box upwards. In other words, if you're moving from selection F towards selection A, that indicates an improvement in your condition. Now, I didn't write it here, but I think our score on the example that we gave earlier graded out at around 46%, which is a moderate level of disability. And we've talked about minimal clinically important difference as being 10%. So I want to show what 10% would mean to you. If you took any of these blocks and moved up that check mark from here down lower, for example, and from here down lower, and if on any 5 blocks the check mark that you initially selected moved from a lower level to a higher level, and you did that on 5 blocks and all the other ones stayed the same, that would represent 10%. Now, sometimes you will move worse on certain blocks and better on others, but the idea is what is your total percentage change? If you have questions, send me an email. Just like other areas of this program, I work with you directly so that you can use this effectively in your own situation. So with this Oswestry, would need to move 1 block up on 5 of those categories to have a 10% improvement. Now, if we moved 1 block better on 10 categories, that would mean a 20% improvement in this functional index. Going back to what we talked about of how to grade your improvement, that would reach a level of substantial improvement. For that matter, when you look at the surgical literature or the injection literature or the chiropractic or physical therapy literature, it doesn't matter. They almost all indicate that if their patient or client improves to 20% on that Oswestry or has a 20% improvement compared to their baseline, that's considered a very good result. Not that you won't get better than that, but it's considered a good result. And if that's how you're moving in that direction, then you probably don't want to do anything else until you plateau. Again, I know it can get kind of cluttered. That's why it's important to work with one-on-one to make sure that you know how to use this and interpret it. So let's get back to this and talk about one more term, and that's the number needed to treat. And this mainly applies to medications. And there are some statistics for other treatments like injections, but they're not as robust or accurate as medicine. But the idea of number needed to treat is to see how many people need to be treated with a particular intervention to achieve a declared or designed result. And usually that's 50%. And for pain medicine, it's how many people need to be treated with a particular medication for one of those patients to get 50% relief. Now, I'm showing this here because it is very, very important to take a look at this in light of narcotic medications. And as most of you know, narcotic medications and the addiction to them have become a big problem in our society. So here's how we look at numbers needed to treat. And you can see this here on the graph where it goes over numbers needed to treat for various medication. And the lower the number, the better. The higher number, the less effective that particular medication would be. And let's look at another example from that same paper. And what you'll notice is that the number needed to treat for regular anti-inflammatory medications is actually lower than other medications that people often move towards that they consider more powerful. Like with any other treatment, medications work differently on different individuals. Some of you may have responded great to one medication, but that same medication given to someone else you know wouldn't have had that similar effect. That's just the way it is, and it can be frustrating for clinicians as well as it can for patients. So now I want to move into looking at just a few examples of research that has looked at a few treatments, some different treatments, and so that you can see the amount of improvement that these research groups have gotten. So let's move forward with that.